Meet Miss Wander. She is a 69-year-old woman with progressive Alzheimer's disease living in the secured dementia unit of a long-term care facility. One morning, while looking for somewhere to sit, she overreached forward and fell onto the hallway floor. Although she was not injured, no one assisted her up for 7 minutes. Her gait and posture slowly declined as she wandered around the unit's common areas for 2.5 hours. Miss Wander frequently roams the facilities because she is uncomfortable and threatened when around other residents. In the past 7 months, Miss Wander fell 33 times. 9 of these falls resulted in injuries, and 3 more resulted in head impact. To understand the fall, we must take a closer look into the dynamics of the long-term care facility. This facility was privately owned and considered a leader in the industry because of their staffing levels, collaboration with falls prevention research teams, their many video cameras, along with state-of-the-art technology which allowed providers to readily access residents' electronic charts at any location. At the long-term care facility, 8 different risk assessment and falls management tools are used. However, none of the follow-up forms are consistently completed and reviewed. Let's rewind and figure out why this happened. To investigate this fall, we will use the Systemic Falls Investigative Method. This is a systems approach that looks beyond the immediate causes of the fall to reveal other hidden influencing factors. This method shifts the focus from the faller to the system and removes the blame. To show this, we will use the Swiss cheese model of accident causation. This model includes unsafe acts, preconditions, supervision, and organizational factors. Essentially, the holes in the Swiss cheese represent the flaws in the system. This investigation was conducted in collaboration with the Technology for Injury Prevention in Seniors program. Research teams continuously collected video data from the long-term care home where Miss Wander lived. For this case, SFIM investigators examined the investigated fall, staff activities 24 hours prior to the fall, and video clips for previous falls to identify recurring patterns. For example, 9 times Miss Wander fell as a result of direct contact with another resident. In other occasions, she was pushed, pulled, bumped into, or hit by another person or their wheelchair. Yet very few of these interactions were recorded in the incident reporting system or addressed in the falls prevention plan. This final video shows an example of 7 falls included in the other falls category. Other falls included are missing a chair seat, running into a wall, bumping into a laundry cart, losing balance after a turn, and tripping over a door frame. Anyways, let's take a closer look at Miss Wander and the factors that influenced her fall. Miss Wander has a variety of health concerns. She has limited ability to verbally communicate her needs. She suffers from poor vision, muscle weakness, incontinence, low blood pressure, and gastroesophageal reflux disease, which has resulted in her malnourishment. Her body mass index is 16.9, well below the normal range. However, feeding tubes and force feeding are not an option for Miss Wander, as her husband requested a comfort level of care. Because of her complex needs, she requires more attention from staff at the long-term care home. Her advanced Alzheimer's often prevents her from communicating her needs verbally. At the time of this fall, she displayed nonverbal behaviors indicative of her need for a bowel movement. Care aides are generally untrained to recognize nonverbal communication clues of these high-needs residents. This communication barrier exacerbates a need for more intense supervision, but in this situation, that was not the case. Now, why didn't Miss Wander have more supervision? The fall occurred during the scheduled staff lunch break rotation. Staffing levels during this time are always low. This does not allow for close supervision of residents with complex needs, like Miss Wander. As stated, Miss Wander roamed unsupervised around the unit for 2.5 hours before this fall. All of this wandering made her tired. Her gait and posture visibly deteriorated. She began to lower herself onto the floor. Why was she wandering for so long? Strategies used by care aides to settle Miss Wander were unsuccessful. As stated, Miss Wander laid on the floor after the fall before help came. Why? All available staff were preoccupied setting up for lunch and helping with scheduled bathroom breaks with other residents. They missed signs of visible fatigue and deteriorating gait. Importantly, staff training was reduced due to loss of government funding in 2012. There was a variety of factors that contributed to Miss Wander's falls. There was an incompleteness of the falls report for her previous 33 falls. Reports focused mainly on vital signs, injury, and staff actions after the fall and did not document actions or conditions leading up to the fall. Why wasn't the reporting system used to its full potential? Because the staff were not trained, rewarded, or required to implement meaningful change, and there was no follow-up system in place. Proposed interventions such as close monitoring, encouraging rest, improving food and liquid intake, ordering hip protectors, and installing bed alarms were ineffective. Why? The care coordinator responsible for fall reduction was a part-time employee and had minimal training in falls prevention. In the past year, the organization went through management changes and shuffling of duties, so the falls prevention team was less efficient. There you have it, the case of Miss Wander. Let's move to solutions. This is where your expertise is needed. Which contributing factors do you recognize in your long-term care organizations? What would you suggest needs to be done to remove system-wide factors that contributed to Miss Wander's falls? If safety in long-term care facilities is everybody's business, what is your role?